You know what it feels like to provide care for people and make a difference in their lives. That's why you went into medicine.
Health is personal and a family value, but health care is a personal, family, and community value.
Do we have fair and accessible health care in Colorado? Barriers exist. People lose jobs. They lose insurance. People are underinsured. They do not seek routine medical care. They go to ERs and urgent cares with serious problems.
When this occurs, it affects every single one of us. When that individual comes in a time of crisis, not only is it hard for that individual, but it affects the people around them. If they're a business owner, it affects their business. If you're someone who pays for insurance, well, you help to recoup some of the cost for the hospital that they lose in that uncompensated care. This is a problem that affects every single one of us, not just the individuals who don't have insurance or don't have enough insurance.
We need access to health care to assure a healthy workforce. Quality of life is important to you and me. The ability to provide for our families, to enjoy the fruits of our labors, and access to health care is an important component of quality of life.
Kids who are healthier learn better in school. Their parents miss less work and are more productive. Kids who learn better graduate with more skills, knowledge, and self-confidence. They enter college or the workforce healthier and more likely to succeed and give back to their communities.
Medical care in the state of Colorado is not being provided fairly. There are many people who can't get any care on a financial basis, and many more who only can get a little bit of the care that they need.
In Colorado alone, we have over 800,000 people uninsured and another 600,000 that are underinsured. The result of these people not getting preventive care and screenings is that they get sicker, we cannot detect it early enough, and they go to very expensive places for care.
This lack of access hurts my entire community. We all enjoy less health, productivity, and quality of life when so many aren't connected to affordable care, especially primary and preventive health care. Ultimately, these people in my community lack many of the basic tools necessary to give back to the community as healthy, productive adults.
You know that as a physician, you're the best judge of resource use for your patient and for the medical care system. Many studies have demonstrated clearly that the more physicians are involved in the process of care, the more likely we are to reduce the cost.
I think it's important to really talk about, as physicians, the role that we play in addressing this critically important issue. When it comes down to access, the key players aren't the legislators, it's not the politicians, it's not the newsmakers. It really comes down to two groups. That's the patients and that's us, the physicians. And as physicians, we have a profound, profound opportunity to really try and improve access in a way that nobody else can.
We may have differing views, but all physicians in Colorado need to come together and find commonality. Imagine 11,000 doctors coming together and speaking in one voice.
This is urgent. We as physicians need to take the lead in healthcare reform.
There's a lot of finger pointing about whose problem this might be or who caused this, and I don't think that's necessarily productive, but I do think it's important to recognize that the responsibility for fixing that lies with all of us.
We can have a partnership. This partnership will allow patients the best access to high quality care and will also save the resources, the precious resources of our healthcare system.
The next time you're with your patient, think about this. What can you do with that patient to improve their process of care and thereby reduce costs? Ultimately, what we want to happen is if we can reduce costs, what we're going to do is improve access by improving coverage.
In healthcare, every time we waste resources, somebody loses access. Yes, we have multiple demands on our time and attention, but we need to be sitting down with our patients and having those difficult conversations about the choices we make and about using our resources wisely and effectively.
Can we continue paying for the most expensive health care for the poor quality we're getting? Imagine our society spending less while improving our quality of care. Imagine our society, like others with similar resources, making access to health care and health care a priority.
What can we do? We can have discussions with our colleagues, medical societies, including Colorado Medical Society, to face these challenges. We can encourage our patients in conversations regarding accessibility, test costs, and care. We can encourage insurance companies to expand coverage.
Volunteer a couple hours a month at a community clinic offering access to those in your community who can't see a doctor except in the emergency department or hospital.
Just for one patient per month or one patient per week, empower your receptionist when he or she answers the phone to schedule one uninsured, underinsured Medicare or Medicaid patient to see you for their medical care.
Join your peers in a dialogue about how our community can ensure health care is always available when needed.
Use your voice. Contact your legislator. Talk to your colleagues, your neighborhoods, and communities.
Listening and talking and really dialoguing, that we're going to start to find that we have much more in common, and that the solutions that we come up with are really going to be acceptable to the vast majority of us. So I think it's time for us to start talking intelligently, listening intelligently, and together we can solve this problem.
One patient and one doctor at a time, we can change the system. You can make a real difference.
Together, we can make a huge difference in the lives of people and the health of the community.
Together, we can affect the change we want to see and make Colorado a much healthier state.